Who is responsible for consent in that respect? Is everyone responsible for consent? Is it still falling on the lap of the clinician in charge?
This is something that we have been discussing at Dental Protection, and I do get these questions coming my way that I've done my part, but the ultimate sort of responsibility falls upon the TCO, the treatment coordinator, to get the consent done, to make sure that the patient fully understands the consent, and so then they're in a position to proceed with treatment. I think one has to tread very carefully with treatment coordinators. Some of these treatment coordinators aren't even GDC registered, and they do not have the understanding, the knowledge that a dentist possesses. So you've got to be very careful, and that opens up a can of worms in terms of vulnerability for not just the practice, but obviously the practice owner, the dentist in question, who's at sort of the initial starting point of the treatment journey. So you've got to be thinking very carefully that if you are going to be using treatment coordinators, what knowledge do they possess? What training do they possess? From a CQC perspective, when I go in to do inspections, that's the sort of thing we ask. We say, well, tell us about the training that your treatment coordinator has received. Where has that training come from? What log or evidence does that TCO have that they have undertaken these roles? And as far as the registration with the GDC is concerned, if a patient makes a complaint, they'll inevitably bring the TCO into that complaint with them. And if the GDC find out that there's a treatment coordinator that's been issuing advice, dental advice, gaining consent, then it's almost like finding somebody who's doing teeth whitening and they're illegal practice of dentistry. So to my fellow colleagues, I think we have to tread very carefully.